mute yourself because we don't want the disturbance. The participants are entering. We are jumping into one near to 150. Let's all of them get entered into our Zoom. Once they are in the Zoom room, we will start the session as early as possible. So kindly give us a couple of minutes more time. We will be starting pretty soon. During this time, those people who are attended our previous program and what we are doing for the past, kindly come to the chat box and put what is your review about online dentistry's program. How do you feel about this platform? Will you refer to your friends? Should we do some modification? Just criticize us. Whatever you feel required to be changed, let us work as a team. We are all in one platform. We are all in one fraternity. So if you have any views which you would like to do us from our side, modify from our side, we can really consider that. That means that is a real privilege from what you're doing for us, so that we can grow, we can modify, we can do the best thing for you. So each and everybody's time that you spend with us would be fruitful. That's our aim. In the WhatsApp group that you are in, people are there for the past 1 year plus. We started with only 2 WhatsApp groups. Now we have grown into 54 WhatsApp groups and 12 exam alert groups. Plus we have our website registration is nearly 15,000. So thank you so much for the enormous support that you have given to us, all because of your blessings and because of your critically pinpointing, telling Dr. Joby, you can do this program, you should keep this time, you should include this kind of topics. So much advices you all have given to us, and we are trying to fulfill. Our team is working hard to fulfill all the requirements. Our privileged and honored members who have registered in our online net and also to the WhatsApp where we have direct communication with them. They are all with us, and we all take care. We share some articles, some good courses which comes. We all share with admin's permission. We do share that. So if you are not in our WhatsApp group, this is the time to join, and this is a lockdown time. You can really learn a lot in this online platform, so that you are locked down, you won't feel secluded, you won't feel alone. You will feel that you are learning dentistry, and you have a mixture of people attending our programs across the world, starting from first year to final year, to interns, to practitioners, just started practice, many years into practice. We have lots and lots of mixtures of people from 144 countries in the world. We are now in 144 countries in the world, attending from many places. So just to give us 2 minutes more time, then we'll be starting the session. So we'll just listen to our timeline, how we have grown up from just 2 groups to this group. Thank you so much. That is our timeline, how we started. So let us start the session. It's 8:05 and we have almost 185 or crossing 185. I think the Zoom is more stabilized and let us start the session. So as we have told you, our motto is to just redefine dental education to provide quality treatment the best way that we can. We have offline courses and online courses there. We established in 2007 and started in 2008, and we have about 15,000 more followers. We can check in our website. You can register in the website. There were a lot of notifications, a lot of free frisbees are there in website where you can get articles, previous sessions can be watched. All things are available in our website. All you need to go www.onlinedentistry.in, register for a free account, no payment, nothing. It's a privilege ownership number that we are giving, and you can watch our previous sessions which are being permission given by the previous authors. They give permission and we have posted in our group. We have started Dr. Binuti Abraham, orthodontist, practicing in Alva for 22 years. He is one of the co-founder of Online Dentistry, the CEO of Online Dentistry. Sir and myself, Dr. Joby Peter, I was a former professor and head of the department, Malabar Dental College. We both worked together, we gelled together, formed a team and started this firm in 2008. And with God grace, we are in 2020-21, and we are one of the leading online dental education in India at presently, giving lots of free webinars during this lockdown time. And with all the blessings of our students who have come and attended our courses, they have referred us after knowing our courses, offline courses mainly, and we have 10 centers across India. And Delhi, Greater Noida, Dr. Sanjit Paul is the chief coordinator who's managing Delhi. And Gujarat, Ahmedabad, Shalim Shah is a coordinator who is managing them. In Pune, we have Abhishek Soni, who's managing Maharashtra and the central part of India, and Dr. Veena, professor and head of the department, Bangalore, she's managing. And from Tamil Nadu, we have a vast number of coordinators, very huge sector we are managing. Dr. G. Mohan Chidambaram, Annamalai University professor, he is managing one part of Tamil Nadu and Chennai, which is a greater circle. We have two coordinators, Dr. Jeevaratnam, Professor Balaji Dental College, and Dr. Ramesh, GDC, working, both of them are managing in Chennai sector. And Coimbatore, again, Dr. Ramesh is managing. And we have the last center we started is in Madurai, Dr. Deen Dayal, Professor, CSI Dental College, a prosthodontist, sir is also managing at Chennai and Tamil Nadu. And where are we from? We are from Kerala, the God's own country, and our home center, the head office is here, that is in Kochi, Alva, on the banks of River Periyar, which is a very religious pilgrim center and a beautiful river to visit, but it can be dangerous during this monsoon season also. So welcome you all into our home center when this lockdown gets over for offline training. You are all welcome. As I said, all the offline courses are currently suspended due to the COVID situation, as you all know. But we will be soon coming up all the offline programs once the things are started and we are again reopening all the centers. So currently we moved into online platform where we started with the free webinars and you are attending this free webinar. This is 1 year, 4 months over once we started our free webinars, and we have crossed more than 450 free webinars and paid webinars. We have another segment called paid webinars, which only for certain topics which can be taught. Some effort can be given, ideas can be given to the practitioners, and we got a tremendous response. Every month, one paid webinar on one Sunday is going on. And this month also, one paid webinar is going on with expert faculties, guest faculties are experts in certain fields of dentistry. So it's basically for practitioners who are want to mold their practice and learn from their home. And the free webinars, please do not miss this kind of simple webinars, free webinars with topics you might feel it is so, my God, I'm giving LA every day. What is there to learn, Dr. Joby, about LA? But listen, you might get 2 to 3 tips of things which experts are doing it there. So all about local anesthesia is a must attend topic there. Orthopedic movements at young age. Let me tell you, when we used to study about Balaji, the Balaji textbook was the only source in India where to learn about orthopedics. And we just used to mug up, used to see the questions which has been asked in ortho, and we used to study particular to that question only because it was something which cannot be grasped. We are having an amazing session on orthopedic movement at young age. Do not miss that. Concept will be made clear to you. Then you read, it will be very easy. And for general dental practitioners, this is the future of practice in dentistry. You cannot miss that. And orthognathic surgery, a famous surgeon, a MPBS doctor, a BDS, MDS, MDS, double MDS, that means oral surgery, and orthodontics, he is an MDS, and he has done his surgery. Such a famous surgeon is going to come and he's going to showcase his cases in a simple way and what a dentist should do. That's it. He's not going to talk about high-fi stuff. What a dentist should approach an orthognathic surgery, how it should be done. And this is one of paid program on 30th Sunday. We are having registration is going on in tremendous way. Soon we are going to close down. We do not give much candidates. We give a limited option only. A closed group or we are planning on CBCT in dentistry. 5 hours of lecture and another 3 to 4 hours of exclusive hands-on for very few seats. Carestream, CBCT software will be given to you. You have to install. You have to be with us with a computer with the specifications, and you will be doing live hands-on diagnosis of minimum 3 to 4 cases. You will be diagnosing how a radiologist is diagnosing. You will be diagnosing it. An amazing session that is going to come a hectic Sunday from morning 11 to night up can go up to 6:37. Be prepared for that session. Registration is going on for that. And one topic which you cannot avoid in your practice or when you're doing your BDS as a graduation is mouth breathing. You go to orthodontic department, mouth breathing can come as an essay, short note, or anything. Pedo, it's one thing. Viva, it's one thing. As a intern, when you started seeing OP, mouth breathing was a habit. When you started your practice, mouth breathing was a habit. So how this habit is to be treated in the current concept of holistic dentistry is being said by a pedodontist and an orthodontist who can guide you a better way. So do not miss. It's a free international symposium with great moderators from UAE, Dr. Raghavendra Shetty sir and Dr. George Thomas sir is 50 years into general dental practice. Can you imagine? He was the past president of IDA Central branch, so IDA all over India. So sir is going to come and he is going to share his experience a little bit. And another moderator, Raghavendra Shetty sir, is going to come international scenario of what is happening. And then Dr. Binu and myself is going to take up the session. So do not miss this international symposium. Register at free at our website and you can get the certificate of participation. And our last part of this is exam alert group, like what you are attending today. A basic program like this is going to come tomorrow and day after, Friday and Thursday and Friday on exam alert portal. And what are the subjects? Watch out for this subject. These subjects are very tough sometimes in our undergraduate. And experts, Dr. Priya, who is a professor and a head professor in the Department of Conservative and Endodontics in Malabar Dental College, she's going to come 10 topics. She's going to explain how you should approach for an exam and that concept, simple way, she's going to explain that. Do not miss it. You might feel it might be only for a student, but an endo and conservative, these topics, even it is applicable for private practice also. Do not miss this topic. And after that, on Friday, again, Dr. Utkal is a professor of oral medicine radiology. He's going to come another 10 topics, which are very important topics. So concept are going to be clear in front of you. So this week is very hectic. Be with online dentistry, and this week is going to be very hectic, and you will learn lots and lots of points there. And next week, we are going to put in a WhatsApp group, but I'm just brushing it and telling you oral pathology. 10 topics will be covered in oral pathology concept by Dr. Jayanti, professor head of the department, Azizia Dental College. She's going to cover oral surgery. Dr. Balakrishna is a famous teacher in all the platforms. Sir is going to come and explain 10 topics on oral surgery. Periodontics, Dr. Vivek, GDC Kottayam. Sir is going to come and explain 10 topics in periodontics. Prosthodontics, none other than Dr. Eldor Koshi, another good academician. He is going to come and tell topic. And finally, periodontics by myself. So next week, you can imagine the topics we are going to cover. Be prepared. Be there. Do not miss this topic. All starts at 7:30 p.m. Indian Standard Time until 9 to 9:30 p.m. Indian Standard Time. Do not miss that. And if you are still not the WhatsApp group of online dentistry, you are free to send the code EA so that we can add you into these groups, exam alert groups, and you will get all the updates. Please do refer to your juniors, seniors, anyone who is practicing. I know there are senior most dentists, maybe your cousin is doing BDS, your cousin's brother, somebody is doing BDS somewhere. Refer to them, attend these topics. Do not miss these topics in this lockdown time. All our free session coming up there. And we are very happy that we are associated with the Lincoln University, Malaysia, and we are having an international certificate program, one-day program. Next month, the talk is going on. We'll be soon announcing the registration process of this international program organized by Lincoln University, and online dentistry faculty, myself and Bidu are adjunct faculty. So you are going to get a Lincoln University certificate of participation for this program, which we are going to announce it very soon, maybe 2 to 3 months. So be in the WhatsApp group, be listed in the website, go see, you can register there in the website themselves. And coming to muscles of mastication and its importance today, we have none other than Dr. Binu, the CEO of Online Dentistry, to talk about it. Please note that this is a series of program. Part 1 is the basic anatomy he is going to cover. Everybody should know the basic anatomy. Lifelong, if you're practicing dentistry, you should know this in your brain. That is it. And tomorrow, I'm going to come with the clinical application, how these muscles of mastication can be applied. So to talk about Dr. Binu, as I already mentioned, a person to meet, a talented practitioner, more than that, a passionate photographer and an international speaker who has gone into almost many international communities where he has given his multiple talks. And in India, many associations, he is associated, international association, national association, local association like IDA, very active member of the IDA of his branch, and is the person that you have to meet. So I just welcome Dr. Binu to hand over the podium to Dr. Binu. Dr. Binu, you can take up the podium. Thank you so much. And Dr. Binu, are you there? Yes.
Yes, Javi. Thank you so much. Can you stop your share and I can start mine?
Yes, I have done that. Binu, you can go ahead. So meanwhile, candidates, if you want to criticize us, please come to the chat box, come to the WhatsApp group, do that. Thank you.
Good evening, one and all. Thank you very much for coming in big numbers again. But a small request, please come in video, all those who can. It's a request. It's a Akash, you're always there for so many classes. Thank you so much. It makes a big difference. Devyani Ellen, she's been there for like 1 year now, ma'am, right? So we have people coming in videos for me. They come in for me, I know. Thank you so much for coming in for me, because it makes a huge difference from the speaker perspective. My topic today, that is what? Muscles of mastication. Guys, it's such a simple topic. I have no clue why 300 odd people are here. But let me tell you one reason why we added this topic into our mainstream topics. Myself and Dr. Jobby personally went to multiple TMD courses, NMD courses, neuromuscular dentistry, temporomandibular disorders. We went to multiple courses all around the world. And whichever area we go in, the professor just comes in and talks, oh my God, the masseter, you have to palpate the masseter. We have no clue where the damn thing starts, where it originates, where it inserts. But they talk as if we know everything. We were like, myself and Dr. Jobby looking at each other. This is way back in 2010 I'm talking about. I told Dr. Jobby, if we are doing a program on TMD, all the students attending the program on TMD has to attend basic anatomy. These so-called big speakers in America or UK, they talk big stuff, which we are like, okay, good. But we spend so much money, 10,000, 11,000 US dollars for like 7 days. We have spent already. So we can't say bad about it. We have to say, oh, it's such an amazing program. What was it? We didn't understand a thing because we didn't know the basics. And there were so many people with us at that time. They all said the same thing. There should be somebody, there should be some pre-conference courses at least to teach about basics. That was the reason why when we do a program on muscles of mastication or the trigger points, so that's coming up tomorrow, the trigger points, headache, TMD. TMD is not covered tomorrow, but more of trigger points. When you talk about trigger points, and if you do not know about which muscle Dr. Jobby is talking about tomorrow, and where is it originating, where is it inserting, and what is the function, what is the purpose of that class? And the next week, next Monday, I think Dr. Jobby didn't tell that in the list. Next Monday, there's a great program coming up by one of the finest TMD specialists I know, Dr. Deepak. He's talking about TMD. And he is also going to talk about big things about masseter and lateral pterygoids and all that. That is the reason why I am here today, to pave way for these speakers like Dr. Jobby tomorrow, Dr. Deepak next week. It's going to be so easy for them to talk if these basics are cleared. And I already did my tongue anatomy last day, a couple of days before, and many people attended. I talked about this chaurasia and this thing and all that. I even said in the last class, those who missed the last class, I even said about I had to dig pictures way back in 1990s of the anatomy department of Kasturba Medical College, Manipal. So I went back 30 years to prepare for this lecture. Now you guys will be thinking this is going to be a 30-year-old lecture coming up. Nothing like that. This is muscles of mastication simplified. I'm going to come directly to the point. No time to waste. It's a short lecture, actually. It's a very short lecture. Listen carefully. You don't have to even write down. I would say just listen to me. Masseter, muscles of mastication simplified. Let's start one by one. And the first one, sorry, I have to get this videos out of my way so that I can see my slides. Masseter muscle. Masseter and temporalis are the two muscles I'm going to talk about first. Reason being, those are the two muscles so obvious right here. So I'm going to talk about those two muscles first. So obvious right here. You can palpate yourself. So the first two muscles of mastication, masseter and temporalis. I'm going to start with that. Sorry about this because this window is or encroaching onto my video so that I can't see my own slides. Here you go. Let's start with masseter. Masseter muscle, quadrangle shaped muscle. Quadrangle shaped muscle, big muscle here. And look at the picture and where does it originate? Where does it insert? Can somebody come to the chat box? That's typical online industry style. Can somebody come to chat box and tell where does it originate and where does it insert to? Just to know your level of knowledge. It's not to know your level of knowledge. It's just to know whether people are listening to me. That's all. There are like 300 of people here. Just want to know whether they are listening to me. Zygomatic process, lower border, inserted in the TMJ. Inserted in the TMJ. Okay, let's see. Masseter muscle, quadrangle shaped muscle, originates from. Okay, let me tell you, before going into masseter muscle, I can tell you one thing. All the muscles of mastication originates from the cranium. Okay, I have this friend of mine up here. Everything originates from here and then attaches to this. Attaches to this. Cranium to the mandible. Because we are dealing with mandible, we are dealing with opening and closing, obviously. So every muscle originates from the fixed structure and then inserts to the mandible. Simple way to look at it. Now, the masseter originates from the anterior 1/3 of the zygomatic arch. Let's not go into that much detail because the primary aim of this program is for private practitioners to understand roughly from where it is originating is from the zygomatic arch. Zygomatic arch to the ramus of the mandible. So here you go, the zygomatic arch to the ramus of the mandible here. It's right here. Dr. Joby is going to explain about how to palpate it tomorrow, the trigger points tomorrow, but you should know where it is starting. The zygomatic arch, inferior border, inferior and inner medial border of the zygomatic arch to the ramus of the mandible out here. So prominent here. You clench nicely, you can see it. That prominent is your masseter. You really open or you really clench. There are even reports, there are even articles showing that masseter is so strong that it can even create a fracture to the zygomatic arch. That's strong this particular muscle is. So you have origin from the zygomatic arch to the ramus of the mandible. So you can see here from the zygomatic arch to the ramus of the mandible down here. Inside there is another muscle. Don't look at that now. We'll talk about that later. So you're talking about the masseter right here, the most prominent one which anybody can identify. I decided to put a cadaver picture also. Look carefully from the zygomatic arch inferior part to the ramus of the mandible. Simple. The most prominent quadrangle shaped muscle, which is from the zygomatic arch to the ramus of the mandible. Now, this is just to make it a little more clearer or maybe to make it more confusing. I don't know. This is a cadaver video which I got recently. In supine position, obviously, the patient is lying down. So the cadaver is lying down. So you can see the zygomatic arch. That's the zygomatic arch. And you have the masseter muscle. The whole chunk is the masseter muscle attaching to the masseter tuberosity here. Masseter tuberosity of the zygomatic, of the ramus of the mandible. Now, function of a muscle. I already covered that multiple times in this program as well as a couple of days before in tongue. I has to go to O. Insertion has to go to O. Ayo. 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 Whichever part of India you are in, you cannot forget Ayo. I has to go to O. Ayo. You get hurt, you're happy, you still say Ayo. That's India. Ayo. In North India, South India, wherever you go, Ayo is there. Insertion has to go to origin. So, insertion, I told you, ramus of the mandible here, has to go to origin. See what happens if I goes to O. When I goes to O, what happens to the mandible? Mandible has to elevate. It's the elevator muscle. It helps you to close your mouth. Close your mouth. It helps you to close your mouth. Meseta, clinically relevant point which you can think about. Number one, I would say TMD. Temporomandibular disorders. If you see a patient with TMD, look at the meseta. Look at the overall shape of the face. TMD means meseta. Of course, all other muscles of mastication contribute, but meseta plays a big role. It's one of the easiest muscle to palpate. Most hypertrophied muscle for a bruxism. We had a separate session exclusively on bruxism for private practitioners. But these points might give some added advantage for the students listening to me. Bruxism. We're talking about meseta hypertrophy. And Botox, that is becoming so famous now. The most famous Botox injection site is meseta. Meseta Botox injection is the most famous, and we online industry, let me be so proud to announce that we even did a program on Botox by one great Botox specialist. We might repeat that soon. You have to listen to him. Things he can do to change the face of people. The celebrities which you see now, believe me, are into this. So meseta Botox is the most common. So I just wanted to give you an idea about meseta muscle and its important, its clinical relevance at the Botox part. Coming to temporalis. Temporalis is a fan-shaped muscle. Fan-shaped. Something like our Chinese fan. Yeah, the fan-shaped muscle. Look at the fan-shaped muscle there. Originates from the whole temporal fossa, from the whole temporal fascia there, the temporal bone. Entire rim of the temporal fossa of the skull and inserts to the coronoid process. So you have the mandible with the condyle, talking about the coronoid process. Inserts to the coronoid process. Condyle is pretty famous, but you're talking about the coronoid process, which takes up the temporalis. Temporalis muscle originating from the temporal fossa, the entire rim of the temporal fossa to the coronoid process. That's the coronoid process there. Let's look at cadaveric thing again, because this is the most easiest one here. Dissection table. Way back in your first year, I'm sure you have seen all this, but I don't know whether you recollect all this. And now I have personally got connected to at least 10 students who are first year BDS and even MBBS. They haven't seen a cadaver. It's all online going on, online. I have a good friend of mine attending this program tonight. He has joined a medical university, MBBS in Russia, but attending online only. So we had a chat today and I told him, come and listen to this because anyway, you are seeing only online. So let's see more and more stuff. They are not seeing cadavers anymore. The first year getting over without seeing a cadaver. Can you believe that? So this is the temporalis muscle, the whole fan-shaped temporalis muscle, temporal fascia, all around the temporal fascia. See, that is the fascia being taken off the scalp. So that's the muscle. And it has those fibers which are vertical, oblique, and horizontal. There are different types of fibers doing different jobs, and everything inserts into the coronoid process. See, the instrument disappears. Instrument disappears there because under the zygomatic arch, from here, under the zygomatic arch, it goes and gets connected to our condyle, the coronoid process of the mandible. So that's the temporalis muscle. Temporalis muscle, the whole temporal fascia, fan-shaped, has vertical fibers, oblique fibers, and horizontal fibers, all connecting together into a tendon and connecting to the coronoid process. Now, IO. I has to go to O. Insertion has to go to O. So what happens when the insertion goes to O? The mandible has to elevate. Again, I told you it has a horizontal fiber, oblique fiber, and the vertical fiber. They all do different jobs, but at the end of the day, it all pulls the mandible up. It elevates the mandible. It's an elevator muscle of the mandible. Like masseter, this is another elevator muscle of the mandible, to be very clear. Are we together here? Are we together here, guys? Can I get a thumbs up? Those who are in video at least, tell me, are we going together? IO again. Insertion has to go to origin. Clinically relevant point regarding temporalis. The first point always comes up, TMD. Temporomandibular disorder, you better know about temporalis. I have a headache in this area. My husband is my headache, but my headache is in this area. I've heard everything related to TMD. Listen to me carefully. TMD is such a complicated field. And do not miss the program coming up by Dr. Deepak. He is so good, so practical. I told you myself and Dr. Joby traveled all around the world to learn about TMD, but we had to come back to Dr. Deepak Bangalore to know what exactly we are talking about, because these so-called big speakers talk about big things. Only when you talk big things, they think that they are big. They have no way to come down. I feel a speaker has to come down. Basics is so important, whether it is TMD or whether it is any other full mouth rehabilitation or whatever in dentistry. Chronic tension type headache. Haven't you heard patients, or very less practitioners are here? I think it's all students listening to me. Patient come walking into the clinic and telling, doctor, I have been diagnosed as I have a chronic tension type headache by my headache specialist in so and so place. Oh, great. Chronic tension type headache. That is just another terminology to tell on, instead of telling on face, hey, you are mad, you have no problem. But they use the terminology chronic tension type headache. Guys, this is all related to our temporomandibular joint, our muscles of mastication, and how these muscles react due to different stressful situations. Stressful situations. I had a patient with severe temporomandibular pain, severe pain sitting in front of me. I checked her completely. I palpated all the muscles. The palpation part will be covered tomorrow. I palpated all the muscles. I found out that she's pretty much okay. I can't see any pathology. Her articular disc functioning perfectly. All muscles of mastication functioning perfectly. There is no reduction. There is no, the TMD has a lot of classifications, muscular part and the disc part and all that. She's okay. I kept on talking to her. I kept on talking to her for at least 20, 30, 35, 40 minutes. And she told me, I just found out that my husband has a relationship with somebody in Facebook. So I have been so stressed out last 30 days. That is enough, guys. That 30 days of severe stress from her point of view, it's not a joke. That is enough for the muscles to act weird. That is enough to get the trigger points. That will be shortly covered by Dr. Joby tomorrow. So you have to listen to Dr. Joby tomorrow. Mine is just a curtain raiser, I would say. But when he talks about a muscle, you better know which muscle is he talking about and where is it originating, where is it inserting. That's my job tonight. I'm going directly to my job. Am I going correctly?
When we don't have a heart, only head, we consume infinity, only one. When we have enough head and enough heart, we understand infinity, infinity.
You feel like taking me like this? Oh, get out, Dr. Binu. We know all this. Come on, what are you talking about? This is such a simple thing. Why did we waste our time on this? Is that your mentality? Let me go forward. Medial pterygoid. Medial pterygoid. After masseter and temporalis, let me tell you, medial pterygoid is a little on the tougher side. Listen carefully. Medial pterygoid muscle. Insertion. Origin. Where is the insertion? From the medial side of the ramus of the mandible. Here you go. Ramus of the mandible. You have the masseter. Exactly opposite. Inside. Inside, you have the medial pterygoid. Medial surface of the ramus of the mandible. What is the function? It's actually a sling. It's actually a sling if you look at it. The lateral pterygoid outside, medial pterygoid inside. It forms a sling of muscle that helps in elevating the mandible. I has to go to O. Ayo. Ayo. I has to go to O. So medial pterygoid is another elevation muscle. I has to go to O. Clinically relevant point related to medial pterygoid, again TMD. TMD comes there as first. Whenever you go to a TMD specialist, the first thing they look at is whether it is muscular. And the next thing is only about the articular disc and the displacement and all that. First thing is muscular. So medial pterygoid, big contribution to TMD. And now, can somebody come to the chat box? It's between this muscle, medial pterygoid, and the ramus of the mandible. There's a very famous space. I put this up just because there are many students listening to me. Very famous space in between the muscle and the ramus of the mandible. Very famous space. Can somebody comment about that space? Oh yeah, every day you give injections. Every day you give injections. That is that particular space we're talking about. You have the masseter here. You have the medial pterygoid here. That's the mandible. In between that two comes that space. Isn't that important? A little tilt here and there. Can that be tough? Can that be different? Lateral pterygoid. I'm going quick now because you guys are all specialists here. You know everything. Lateral pterygoid. Lateral pterygoid is odd man out. In tongue also, I told you there will be always one odd person in anatomy. Lateral pterygoid is odd. Lateral pterygoid is completely different from the other three muscles I just talked about. Lateral pterygoid originates from the infratemporal crust of the sphenoid bone. Little tough there. That has a superior head and an inferior head. It's not that bad actually. There is a medial pterygoid plate and the lateral pterygoid plate. There are two plates there. Medial pterygoid from the sphenoid bone, there are two plates, medial pterygoid and the lateral pterygoid plates. The lateral pterygoid attaches to a lateral pterygoid plate, but the lateral surface of the lateral pterygoid plate and medial pterygoid to the medial surface. So I know it's confusing, but please read more. What I can do in a webinar of this kind is gives you some spark, guys. I cannot talk about the complete anatomy with no proper gadget in front of me. I have a skull in front of me, but what can I do here? In front of a camera like this, what can I do? Read more. But you should get an idea about the lateral pterygoid plate. Lateral pterygoid plate is so important. And that is the attachment. Where is it inserted to? It's inserted to the pterygoid fovea. We have the mandible here. Don't know whether you can see this properly. We have the mandible here. In the mandible, inside here, there is something called as pterygoid fovea. I think that picture shown there in the slide is better explanatory than what I'm doing live here. These are the limitations of online classes. People do online swimming classes these days. Come on, I'm doing online anatomy. Yeah, I'm okay. So, inserts to the pterygoid fovea and has some fibers inserting to even to the articular disc of the temporomandibular joint. So, when we have a class on articular disc, we have a class coming up on articular disc and its attachments and all that. At that time, we'll understand that some fibers of the lateral pterygoid is getting attached to the articular disc. Again, function of lateral pterygoid. I don't know whether you can listen to this audio. One very famous South Indian actor, Mohanlal, again talking about one thing, that is IO. He has an entirely different expression towards IO. I told you IO is such a common terminology in Indian dictionary, or the dictionary.com even said IO equivalent to the four-letter word in English starting with F, which I cannot tell here. So IO is such a famous terminology. Do not forget that. Even if you forget me, do not forget IO and the function of lateral pterygoid. Insertion has to go to O, but this is one rare scenario when insertion goes to O, mandible opens, mandible depresses. This is the only muscle that depresses the mandible. All other three, the masseter, the temporalis, and the medial pterygoid, were elevators. Now you have a depressor here because that's the way it's oriented. when I goes to O, I can put that again. When I goes to O, the mandible has to open up. There's no other way. So this is a depressor or an opening muscle, the only opening muscle, I would say, of the 4 muscles of mastication. Clinically relevant point, oh, lots. TMD again. Patient says a severe pain here, sir, severe pain. What to do? You know what you should do? Ask the patient to bite onto a mouth mirror. Bite onto a mouth mirror. Bite. Hey, now there is no pain. We are talking about getting the lateral pterygoids some relief there. Guys, that is temporomandibular disorder and its implications, which you have to learn. But to learn all that, and whatever the TMD speakers say about the muscles, you will remember me that day. That I'm sure. Even if you don't take me seriously today, you will take me seriously when you attend a FMR, that is full mouth rehabilitation program, TMD, that's temporomandibular disorder program, NMD, that's neuromuscular disorder program. Whichever program you attend all around the world, you will have to remember me and the basics I'm trying to cover here. The TENS, transcutaneous, the stimulation part, the K7, the centric occlusion, you name it. Lateral pterygoid plays a role there. And then pediatric cases, your twin blocks. The first thing in a twin block after 14 days, 20 days of twin block delivery, what you see is something called as pterygoid response. Those are doing twin blocks will understand what I'm talking about. So it's so important to know the anatomy of the lateral pterygoid before you even deliver a twin block. Nerve supply. It's all from the branchial arch, mandibular arch. So it's from the mandibular nerve. Nerve supply is not that tough. I mean, I did a tongue nerve supply without much casualty a couple of days before. So this is simple. The nerve supply of all the 4 muscles of mastication, luckily, is supplied by one muscle. One nerve. That's the mandibular nerve, which is a branch of the 5th cranial nerve, the trigeminal nerve. So here you have the trigeminal nerve, which has 3 branches: the ophthalmic, maxillary, and the mandibular. Ophthalmic, maxillary, and the mandibular, 3 branches, of which the mandibular, we call it as V3, CNV3. I don't want to confuse here. Cranial nerve, 5V3, that's at 5-3, is the 3rd branch of the cranial nerve, trigeminal nerve, that takes care of all the 4 muscles of mastication. So you are safe. It's very easy to remember. But the masseter again has a branch called the masseteric nerve. Come on, we can't make things very simple here. So it has a masseteric nerve, and the temporalis is a temporal branch of the mandibular nerve of the trigeminal. Yeah, so it goes like that. Medial pterygoid is a nerve to the medial pterygoid, and lateral pterygoid is an anterior branch of the mandibular nerve, which is a lateral pterygoid nerve. So there are specific names. This is for exam going people, but when it comes to TMD, NMD, FMR, I think this information is more than enough. Blood supply, maxillary artery takes care of everything. From the external carotid artery, you have the maxillary artery that takes care of all the muscles of mastication. So that's also done without much complication. There are some accessory muscles which I suggest you better understand before you go into TMD at least. These are the digastrics and the geniohyoids. It's better to know the accessory muscles of mastication. It's good to know about it. Yeah. So that's it. I'm done. Oh, wow. Perfect. On time. I said 45 minutes. I am done here. I am concluding my topic of today. For those people who found it very silly, oh, come on, I wasted my 45 minutes for this. I knew all this. I've learned all this. For those people, I'm sorry. But to them also, let me tell you, you might have got some point somewhere that will help you remember at some point of time. Whether it is a TMD program, FMR program, NMD program, or a YUI in final year, or a YUI in first year, you will get something out of this. That is the purpose of this particular program. So to conclude, I just talked about 4 muscles of mastication. It's original insertion, the nerve supply, the blood supply, and some little clinically relevant points related to that. While preparing, let me tell you guys, I actually even went into 30 years before my anatomy exam. We had weird faculties at that time. We had faculties giving pictures of this kind and asking to find out the nerve from this. Yeah, come on, that's this bloody noodles plate. Yeah, these kind of weird people were there. We had an anatomy professor who used to make holes in the skull and ask you what foramen it is. Oh my God, you learned all the foramens and now you see a new hole in between the jugand, the foramen, wherever. So we had weird people. I traveled 30 years back preparing for this. I know it's a silly topic, but it is a big topic when it comes to the topics that's happening tomorrow, next Monday, and all that. I thank one and all for coming in here, listening to this, because I took the effort of going back 30 years, finding out myself, looking like a skull. 30 years before, anatomy department, KMC Manipal. Thank you very much. Over to you, Dr. Jobby.
Yes, thank you so much, Binu. It was an amazing session. We had almost 400 candidates in YouTube and in this one. Also, all of you, just one more thing. So you have come large numbers today and next week and for tomorrow onwards, we have so much programs are coming. Please do criticize us. Please tell your comments in your WhatsApp group where you are in. Please post your comments so that we can learn more and we can improvise ourselves. If you have any questions, you can ask in the chat box related to muscles of mastication. Please do refer to your friends, WhatsApp number, Dr. Binu's number, or anybody's number. Refer to your friends. We can add you into the WhatsApp group. We are there. So if you have any more questions, we can. Dr. Shilpa Shetty says that my daughter enjoyed the lecture. She is in first year BDS. That's great, Dr. Shilpa. That's great. That's what. Please do refer to your first years. Any fraternity in dentistry, refer. These programs are all clinically oriented, useful programs. Starting from tomorrow, hectic session, not a day break you can have at the online dentistry platform. So you'll be busy. You will long for evening hours where you can learn something related to dentistry. I cannot get any more questions. You know, all are selling. Thank you so much. It was wonderful, wonderful sessions. So many suggestions regarding a leaf foot fracture too. Yes, we will consider Dr. Ria Gupta in YouTube. And somebody is asking pharmacology for dental practitioners. Dr. Ria Gupta again, as she has given a lot of points, which will all our technical team will note these points and we will come up with this point. Once we promise, we will come up. That is our motto, redefine dentistry. And it will be addressed one point of time. You have to give us a time. So that will be definitely addressed with the specialist in this field. Once you give us a topic, I will search for the specialist, the best person who can give this and more clinically oriented way who can give it. And we have a session with them. We discuss with them. They present in front of us. And then only they will come to the platform. That meticulously we plan behind the screen to make it very interesting and productive. It's not a job. So whatever points that you're giving, we will be considering it.
I just saw in the chat box one very
Appu Morris.
Appu Morris, yeah, even I saw that. Engineering graduate who listened to this, God bless you. That's all I can say. But I think he was listening with his wife, right? Thank you so much. Thank you so much. for doing that.
Yeah, considering increase in the time slot, we will be. I told you, doctor, we are considering it. This is the lockdown time, so we will be doing it this thing. I told you next to tomorrow onwards, you don't have a free day till 30th, the 1st of June. There is not even a single day where we don't have a program. All day you have a program. 2 hour programs are coming up, so you have to stick on to us, and all the topics will be covered in subsequent time. So if any more doubts, I did not find any doubts. I think you won't get a doubt in regarding to this, but tomorrow is a session you might feel asking, clinical practitioners might feel asking a lot of doubt, and students, you might get a lot of clinically relevant points you can put in your answer for muscles of mastication when it comes as a short essay or a long essay, or even any postgraduate level also in orthodontics and pedodontics, they ask this question and its clinical relevance. That's what we are going to discuss tomorrow.
Jinsi M has said that whenever teacher asks about muscles of mastication, I am always confused with buccinator. So, we are planning to come out with a program on muscles of facial expression pretty soon. Joby, why don't we do that?
Exactly, exactly. Don't get
Buccinator doesn't
confused.
really come into the muscles of mastication part, but it's a good thinking. It's a good typing what you have done there.
Muscles, buccinator is an accessory muscle. It's an accessory muscle that assists or help in mastication. But muscles of mastication, what Dr. Binu said, these are the 4 muscles. That's it. They are the muscles of mastication. But
Please
buccinator,
arrange webinar on pharmacology.
yeah, many people are asking them. Many people are
Many
asking.
people are asking webinars. Thank you so much for all these comments. I mean, that's the only way we can improve. And come to the WhatsApp group you are in. You can comment there also. Yeah. Drugs related to TMD. Oh, drugs related to TMD. It is actually coming. I think Deepak sir is going to talk about that, right? I'm sure
Yeah,
Deepak sir
yes.
program will cover about the drugs also, right? Yeah, he
Yes.
did that already multiple times. He's going to do that.
Yes.
He's good.
He has just confirmed it, and he is coming on Monday on TMD. This Monday, a 1.5 hour session on TMD free program. He's going to come. Please do listen. And once you attend this muscles of mastication and tomorrow session, then it will be very useful for you, easy for you to understand about TMD. One question from one response, what I've Hina Padiyar. He said that today's was my first session, sir. It was life-giving and much needed session. I wish we had teachers like you during our BDS days. A student from pandemic batch. She has tagged herself as a pandemic batch. That's fine, doctor. Do not worry. You have more time ahead. You can learn more. Surely, I will look forward with upcoming lectures. That's a great, a kind gesture that you have given to us. Please do refer. And pharmacology, I'm noticing it down. Pharmacology is one session which has been asked by people I know. We will be coming up with pharmacology. So if anybody is first time attending, like what doctor said or person said, you can join us, send the code to us. We can add you to the group or log on to www.onlinedentistry.in. We can add you to the respective groups and you will get all updates, paid, free, UG, PG, postgraduate, all the programs are there. You can choose and you can attend whichever programs at your convenience time. And some programs will be posted for repeat in the YouTube channel. You can watch it on our YouTube channel, online in this YouTube channel also. You can watch which we have permission from the speakers. So be with us. Thank you so much. That finishes today's topic. And thank you so much, Dr. Binu. It's an amazing session. You explained it so beautifully. And we have.
Thank you, Dr. Ravi.
And tomorrow session is same time, 8 o'clock, not 7:30 p.m., 8 p.m. Indian Standard Time to 9:30 time. So thank you so much. Stay safe, stay healthy. Let us pray that this pandemic gets over as early as possible. Happy to see you all. Come tomorrow also on the video. Let's have a good team. Let's work together as a team and grow together as a team, whichever fraternity you are. Thank you so much for
Thank you.
all those people who have come and attended this session. Thank you, Dr. Binu, for an enlightening session. Let me take a leave. Good night and see you tomorrow, same time, Indian Standard Time.
Good
Bye-bye.
night, all. Stay safe. Stay home.